Good afternoon, everyone, and welcome to our state budget advocacy Zoom meeting. We've been having these meetings every other Thursday at 1 o'clock. We're really excited to have a large turnout again today. We are going to make a couple of announcements and then dive right into the agenda. First, I want to do a quick introduction of one of the newest members of the PBPC team. You've probably seen her on a couple of Zoom meetings over the last few weeks. We have Katie Personette with us. She's going to give a quick tutorial for folks on the Zoom meeting views that you can use. Katie?
Hello, everyone. I know we're still waiting for a couple people to join in on the waiting room, but just wanted to go over a quick tutorial here. Most of you should be familiar with Zoom by now, but just a couple things. The way that you're viewing the screen can be changed if you'd like. So on the top right-hand side, there's an icon, gallery view and speaker view. So it's really to your preference. Gallery lets you see everybody who's in this Zoom meeting. And then speaker view obviously shows you who is speaking currently. On the bottom there, you'll see a chat box. So I'll be using that actually throughout this Zoom meeting to post articles and resources in there for your reference. So I will just post in there right now so you know where it is. Please feel free to ask any questions in this chat. Please say, I have a question, and we will get to you. Other things, this is being recorded, so if you, unfortunately if you miss something, we will have the recording for you later. The mute button allows you to be muted, which we will be having on this whole time unless you have a question. So at that point, I think Jeff will get to it. You can unmute yourself, which you'll see on the blue icon on your personal video screen, unmute or mute. Same with the video, and I think that should be it. If you have any questions, please feel free to put that in the chat, and I think we're good to go. Back to you, Jeff.
Great, thank you, Katie. And again, welcome to everyone. We still have a few people joining us here, and we're really pleased at the level of interest in today's Zoom meeting. So let's start off. When I sent out the invitation a couple of days ago for you to register and get the link, we were very excited because we had confirmed State Representative Matt Bradford to join us on this call. He is the chair for the House Appropriations Committee for the Democrats. He was going to talk a bit about what the state budget might look like this next year, in particular, how the crisis with COVID-19 is likely to impact the budget, some of the things that they will have to be working through as they do the budget. Within the last hour or so, we got word from Representative Bradford. Last evening, Speaker of the House, Mike Turzai, announced that they would do an extra session day this week and that they would stay in Harrisburg and do that. Representative Bradford was hoping that he would be free at any rate at 1 o'clock to join us to do this. Unfortunately, it looks like that's not going to happen. So apologies to everyone here. I have been talking with his staff. Tentatively, we are planning to do another Zoom meeting specifically with Representative Bradford to talk about the budget. This is likely to be next Thursday at 1 p.m. So we'll get information out about that and another opportunity for folks to register and get the link. Again, our apologies. He was very apologetic. I don't think he was particularly happy about this additional session day, and Marc Stier will be telling us a bit about some of the mischief that has been going on in Harrisburg over the last couple of weeks. So apologies to folks, but I would encourage you to stay with us today on this Zoom meeting. It will be a bit shorter today than we had planned, and it will definitely be shorter than last week, but we do want to provide you with some updates about some of the things going on in Harrisburg related to COVID-19, and then also a bit about how this is impacting the state's economy and the budget, and some important actions that we'll need to see in order to have the kind of budget that Pennsylvania will desperately need for next year as we recover from this economic crisis. On that note, again, if you have a question that you would like to ask any of the presenters, please just note that in the chat box. You can just put something in, I have a question I want to ask. We're going to start off with the Director of Pennsylvania Budget and Policy Center, Marc Stier, who's going to provide some updates and then take some questions. Following that, I will provide you with some additional information related to state budget issues, in particular how action at the federal level will probably make a significant difference in what happens with our state budget this year. So again, thanks for joining us, and I'll turn it over to you, Marc.
Thanks, Jeff. Good afternoon, everyone. Welcome to another edition of Hollywood Square for Advocates. From time to time when I'm bored on these things, I do change my name to Paul Lind or Rose Marie. Some of you may be old enough to remember them. I'll try not to do it today. So the Republicans are having another session day, and I am disappointed, like most of us probably should be if you don't know. They've been mostly making mischief and grandstanding for the last couple of weeks. About a month ago, or actually about 6 weeks ago, when this all first started, the Democrats and Republicans actually had a deal that no legislation would be brought to the floor unless all four caucuses agreed. That is, House and Senate Democrats and House and Senate Republicans. That lasted for a couple of weeks. What we've seen in the last couple of weeks, however, is a series of moves on the part of the Republicans to, first of all, open businesses and override the stay-at-home order that Governor Wolf put in place, way prematurely in our view. There was an omnibus bill that would do that, SB 631, that the governor vetoed. Since then, they've been breaking it out into a number of pieces. There's a bill running this week to allow realtors and lawyers to open up, another bill on garden centers, another bill on zoos of all things. We have been making statements against all those things. We continue to believe it's just way too premature for us to act as if the disease is over. Yesterday, for example, there were more cases in Pennsylvania than there were the day before. We've seen a slower rate of increase from 34% a day at the end of March to 20% a day 2 weeks later, to about 3% a day on a 3-day moving average as of yesterday. That's much better, but we're not out of the woods yet. And the one thing that people always seem to forget about this when they say, hey, it's time to open the state, is the only reason we've seen a decline in the number of cases, the rate of increase in the number of cases per day, is that we've actually all been doing a good job of following the governor's orders and staying home, and businesses have been closed, and we are not putting ourselves in a position to spread the virus. So we keep encouraging the General Assembly not to rush this. And the other thing I keep pointing out is that so much of what they're saying is based on a fundamental dishonesty. Every one of these bills has said we should follow the CDC regulations for operating businesses of one kind or another safely. I've been all over the CDC website many times. There simply are no such regulations. What the CDC says is if you can't operate your business remotely, virtually through the internet, and it's not essential, you should be closed. That's simply the recommendation. Any business of almost any kind, a retail business, a construction business, realtors, involves people getting together who wouldn't otherwise get together. It involves people passing materials from one another, money, papers, people going to a store and touching things on the shelves, construction workers passing 2x4s back and forth to one another. There simply is no way to do all that without increasing the risk of the transmission of the virus. So we will come to a point, we all hope, in the not too distant future, where we can start getting back to something like our normal lives. I don't think we'll be fully normal for a very long time, because big meetings and things like that are not going to make any sense. And there's always a serious risk that we're going to see another upsurge in the virus. So, we don't know how quickly things will be back to normal, or even how soon we can start opening up businesses and start leaving our homes. I think the governor's plan to do this gradually, taking account the change in the spread of the disease in different parts of the state makes sense. But again, how soon that happens depends on what we actually see on the ground. The other grandstanding that they did this week is calling for a property tax freeze for school districts. And again, that seems to us to be a crazy idea. We understand that in some parts of the state, property taxes are very high. If you've looked at any of our research on property taxes, you will see that's actually not true in most of the state, and it's not true in the state on average. On average, property taxes in Pennsylvania are about the same as they are in New Jersey and other surrounding states. They're far lower than they are in New York, for example. But they are high in some places. And, you know, we have put forward ideas to minimize the impact of property taxes, particularly on low-income homeowners and people on fixed incomes. But at a time when things are so uncertain about what revenues will look like, both at the local level, the school district level, and the state level next year, and when we really have to be thinking very carefully about how to deal with shortfalls in revenues, particularly for our schools, and what mix of local and state funding makes sense to ensure that our students are not shortchanged, it seems to me crazy to prematurely decide, okay, we're going to freeze property taxes. One of our partners came out with some research the other day that suggested we could lose between $1 and $2 billion in local school district revenues as a result of the COVID-19 crisis and the economic disaster that's followed upon it. If that's the case, that's a huge amount of money, and some combination of property tax increases in local school districts where they can afford them and state aid will be needed to make up for that difference. At any rate, it's way too soon to decide all that. We need to figure out what the options are. I'll talk a little bit more about the state budget problem, and there the same thing is true. We need to learn a lot more about what's going to happen, what our options are, how much federal aid we're going to get, and so forth. So that, again, that's just political grandstanding. What they're not doing is they're not voting for protection for frontline workers. Democrats have run a number of pieces of legislation, of amendments to Republican bills. Democrats can't get bills to the floor because they don't control either house. Calling for more protections, calling for hazard pay for frontline workers, trying to raise the minimum wage. There's been straight party line votes against all of that. And they're not providing essential workers with protective equipment or hazard pay or living wages. They're not providing relief to small businesses. They're not doing anything to expand paid family leave and earn sick days. They're not doing anything to suspend rents and mortgages and making housing affordable. They're not doing anything to provide more funding for testing for COVID-19, which is absolutely critical if we're going to be able to get back to a semblance of normal without the disease spreading. And they're not doing anything to fix a broken tax system that takes twice as much from middle-income people as the 1%. So we've been very disappointed with what's been going on in Harrisburg. We actually do have a petition that both Pennsylvania Budget and Policy Center and We the People campaign have been circulating. I think Katie's going to put it up again in the chat box. We would encourage you all to sign that petition. If you can do it right now, that'd be great. We'd encourage you to share it with people. If you're heads of organizations that could get this petition out to members. We've seen, small groups of people come to Harrisburg, and just the other day come to the governor's house in Mount Wolf protesting. They've violated all the health and safety rules when they've done it. They have brought rifles and shotguns. They've been driving around honking horns in residential neighborhoods for hours at a time. They're a relatively small number of people so far, and all the polls suggest that the vast majority of the state stands with the governor and Dr. Levine and all of us. But it would be very, very useful if we could get thousands of people to sign that petition, far more than is going to those protests, and send them to our legislators as soon as possible to let them know that we really want them to be focusing on protecting our lives and health, protecting frontline workers, and dealing with the economic inequalities that have been revealed by this crisis. So Katie posted that again, and I would encourage you all to sign it, send it to your friends, and if you're heads of organizations, send it around. On the budget, Jeff reminded me before the call, it's actually not much different than this year. They haven't, than previous years. They haven't seriously started negotiating about the budget. It's not the last minute yet. And in a normal year, they wouldn't be having those conversations, and they're certainly not now. There's been some talk about a 6-year budget, a 6-month budget rather, and then coming back, presumably a lame duck budget, lame duck session after the election for the second half of the year. That's not a totally crazy idea. The governor said he doesn't support it, but he hasn't ruled it out. We don't really know what would be in that budget. We do expect, however, a fight, a very serious fight. How big a fight depends on two things. One is, what will the revenue shortfall actually be? And as I pointed out in previous calls, we just don't know at the moment. We don't know how serious the recession is. We don't know how deep it is. We don't know how long it'll last. And thus, we don't really have a good estimate of the impact on state revenues. I've seen estimates anywhere from $3 to $7 billion over 2 years, the end of the current fiscal year and the next fiscal year. It could even be higher. We also don't know how much federal aid we're going to get, and that will make an enormous difference as well. But if there is a shortfall, and we even after that federal aid, and we're expecting one, we are expecting a fight. We're expecting the Republicans to call for the kind of deep cuts that Governor Corbett instituted in 2010-11 to education, to higher education, to human services. And we're going to have to prepare to really fight back against those kind of cuts. Again, what the shape of that fight will look like, what exactly they will propose, what the governor will counter-propose, we just do not know yet. But I just want to prepare you all that we're going to need to be very, very active, I think, in order to get a budget that doesn't really do great damage, not just to our kids in the higher education and to people who need human services, but to our state economy. We know that because of the deep Corbett cuts in 2010, 2011, Pennsylvania recovered from the Great Recession much more slowly than other states. And we're expecting something similar could happen if we have deep budget cuts this year. So that's basically all I have to say right now. And I'm happy to take any questions.
Thanks, Mark. We do have a question here from LR Cross. I'm going to unmute LR Cross's line so the question can come to you directly.
Sure.
Go ahead. We've unmuted the line. LR Cross. You might need to unmute the line on your end if you haven't muted on your own phone. Okay, we seem to be having an issue there. The question that was submitted via the chat box, Mark, was, you scroll back up here to this. Can the Commonwealth be held liable for ending the stay-at-home order too soon? Doesn't the U.S. Constitution give health general welfare responsibility to the state? What does the PA law say about public health protections?
I don't think the state could be held liable. To begin with, you really, because of sovereign immunity, you can't sue state governments unless they allow you to do so. So that's really not an option. If it were, I would file a suit against Donald Trump for leaving us all at the mercy of this disease tomorrow. So no, I don't think that's an option. I'll tell you one thing, though. One of the bills that the Republicans have been pushing was to give hospitals and nursing homes immunity against lawsuits for people who die as a result of their negligence in allowing COVID-19 to spread, which, obviously we very strongly oppose, and we think it's just horrible. So if they're going to protect anyone, they're going to protect big business, sadly.
Okay, thanks, Mark. We have a question from Marlene. Marlene, I'm going to unmute your line. You can ask your question directly.
Is it about the Trump? I've done a couple of questions. Are we expecting that Trump not to give our state a fair amount of money because we have a Democratic governor. He seems to be aiming at Democratic governors. Those states run by Democratic governors.
I think for two reasons that's not likely to happen. One is that he needs to win Pennsylvania to be reelected. And the other is that the Democrats in the House will have a very major say in what the next relief package looks like. And I don't think they will allow states like Pennsylvania to be harmed. I do have to say, Pennsylvania, as bad as the situation is here, is not as bad off as some other states. There's some states that will see much higher declines in revenue than we are at this point.
Thank you.
Okay, Mark, we have another question from Ann Martin Montgomery. I'm going to unmute Ann's line now so she can ask a question directly. Go ahead, Ann.
Hi, can you hear me okay?
Yes.
Wonderful. I heard on NPR this morning, and I've been trying to track it back down, an estimate on potentially 40% of the closed small businesses will not be able to reopen. Do you have a source for any, I'm looking to be able to quote something around this. Are there any good sources on how bad the impact will be to small businesses and estimates of those that will not be able to reopen? And any that are Pennsylvania specific?
I have not seen that yet.
Okay, thank you.
So, it strikes me as a little high, although, you know, again, who knows? As I've mentioned before, we got two problems. We have the immediate closure, and then we have the impact of lost wages and having to pay back rent and mortgages and car payments, which people may not have been able to pay. That will create will slow our recovery going forward. Plus the fear among people that it could happen again. So I think the recovery will be fairly slow. We're not going to just return to normal, even if we can all go out. And again, I'm not sure we can do that safely anytime soon.
Thank you for your question, Ann. We have a question now from Chris Hundley. Chris, I'm unmuting your line. You can ask your question.
Can you hear me?
Yeah.
Okay. Yeah, I just wanted to know if there was sort of an updated impact on, or I guess an updated estimate of what the impact of the pandemic is going to be financially, not just on the general fund, but also the ancillary funds, and like what, if there's either an updated number or an updated range that we should be asking Congress to push into Pennsylvania in terms of the next stimulus package?
I don't have one today. I've been trying to work out some numbers to see what I come up with. But, you know, there's just so much uncertainty, and it's also kind of hard to be talking to people in the administration and the General Assembly right now, because administration is you know, caught up dealing with the immediate crisis, and the legislature is caught up dealing with the mischief that the Republican leadership is carrying on with. So I don't have a real update for you right now. I hope in the next 2 weeks we'll have a better idea. We are working also on, and Jeff may talk a little bit more about this, about an ask for the federal government. I think the ask is going to be in the hundreds of millions of dollars for the states, maybe $500 billion more.
Thanks, Mark. Yeah, I will talk a bit about some of what we're going to be asking for from the federal government. But I'm going to move now, and by the way, thanks for your question, Chris. I'm going to move now to Dr. Jill Bartoli, who has a question for you, Mark.
Yeah, I'm really worried about the end of the moratorium on evictions. And I wondered if maybe something like rent support for low-wage earners with rent over 50% of their income would narrow the field enough so that targeted support could be there.
Yeah, I think that's actually a very good idea. Figuring out where we will get the funds for that is very hard. It's, you know, hard to imagine the state being able to do that. But the federal government certainly could. And, you know, frankly, I wanted to say again that when I say it would be hard to imagine the state getting the money, I mean, it's hard politically. We know where we could get the money. We know we have the most upside down tax system, one of the most upside down in the whole country. We know that the top 1% pay at half the rate of the middle 20%, and even less compared to the bottom 20%. There are ways to raise revenue in the state, even in this crisis, that would enable us to do some of the things you're talking about. It's not a practical issue. It's not a technical issue. It's just a moral issue. Who is the state going to serve? But frankly, it's also an economic recovery issue. If you think about how many people are going to be suffering coming out of this situation because they have been working for a number of months, they have maybe back rent to pay, back mortgages, back car payments. Providing help for them would be one very useful way of ensuring that the economy gets started again, because our economy is based on consumption, like any other economy. Most of what is produced for people to consume in their daily lives. Giving people money and letting them buy things, in other words, is how you restart an economy. So there are a lot of good reasons to do that.
Okay, thank you for your question, Dr. Bartoli. Going to move on next. We have just a couple more questions. I need to go back. Okay, I'm calling on Jeff Eisman next. Going to unmute your line now. Jeff, you can go ahead and ask your question.
Okay, great. Can you hear me?
Yes.
Okay, my question is on the additional FMAP, the Medicaid assistance that Pennsylvania and other states have received under the CARES Act. Do we know if any of that is what it's going to be used for, like any rate adjustments or PPE for like home and community-based workers? Most of it's been going to hospitals and nursing homes, but a lot of us support people in the community, and to be honest, we're the most cost effective, and it's where most people want to be. So just be curious to hear your feedback on both the FMAP and anything on PPE. Thank you.
My understanding is that first of all, the FMAP money was not in the CARES Act. It was in the first bill that was passed. I forget the name of it. And what it did is gave us 6.2, an increase in the state rate at which the federal government covers Medicaid expenditures from about 50% to 56.2%. My understanding is that money it can only be used for one purpose, and that's to reimburse state expenditures for Medicaid, for both health care for those with low incomes and for long-term care. So we've seen a huge increase in caseloads for Medicaid, and my understanding is that money is going to be used to help manage those caseloads. There are possibly other answers, and I may be wrong about this. I actually haven't had a conversation with anyone with a lot of expertise beyond mine, but typically the FMAP, the federal reimbursement is in fact a federal reimbursement for the money we spend through the Medicaid system.
Do you have a follow-up on that, Jeff? If not?
I think there is some flexibility in terms of how states use it and who gets what. Is it go to nursing homes for more institutional care, more home community-based services? Is it adjusted rates? Like, do you do it in terms of overtime? Maybe the next call we could have more of an update or something.
I will check with people who know more about this than I do and see if that's true. But
and the PPE too. Thank you.
Great. Thank you for your question.
I was just saying anything that Medicaid spends on will get reimbursed. So if they're spending more for PPE, if nursing homes are spending more and seeking reimbursement from Medicaid for PPE, then that in fact will be covered by the federal reimbursement. So there may be an indirect way, but I don't know if there's a direct way to say, okay, spend the money for this thing or that thing.
Thanks, Mark. we have one more question here in the queue right now. I'm going to go to that in just a second. Again, if folks have any additional follow-up questions for Mark, please just send a note in the chat box, and I'll follow up and let you know if we can pull you on the line here for that question. So I'll go now to Dwayne Heisler, who has a question for you, Mark. Dwayne, you're unmuted.
Thank you. Hi, Mark. You know, we've been seeing a trend in healthcare with, you know, large healthcare facilities getting millions of dollars, and there doesn't seem to be a lot of accountability there. In fact, it's kind of almost, I think, just so crazy that on the heel of that, like one of these corporations, their shareholders is having a meeting to determine what CEO salary should be during this time. Mm-hmm. At a time when, you know, people on the front lines are really struggling and bearing the brunt of this. And so I guess the reason that I bring that up is because the thought of accountability and the thought of monies coming in, and I'm just thinking, like, we all know that over 70% of all businesses in corporations in Pennsylvania don't pay taxes. And I wonder if there's a way to talk about funding that they're receiving of our federal tax dollars and how we might be able to get legislators, or I know it's federal, but maybe there's another way to talk about the idea that organizations are receiving money, yet they're not paying their fair share back to the people. You know, it's almost like a double dip kind of situation. And I wonder if there's any kind of narrative to be had out of that, because I think at some point we absolutely have to talk about revenue.
Mm-hmm. Well, I think that's a good point. I mean, we have been saying for a long time that it's time to fix the Delaware loophole and even more what I call the Cayman's Island loophole, and make corporations pay their fair share taxes in Pennsylvania. At a time when a couple of years ago they got a major tax break from the federal government, and which reduced federal corporate taxes substantially, and a time when they are getting bailed out effectively, unlike small businesses, which are not getting bailed out effectively, and like people who are seeking unemployment who will get the money. I know the state's really working very, very hard to get an unemployment system that was not built for this numbers to up to speed. But, you know, the corporations got their money fastest and first and the most, as always. So this seems to me a very good time for us to demand that the state government fix the corporate income tax system and raise a bunch of revenue. If we just went to combined reporting, which is I'm not going to go through the details today, but it's a way to close the Delaware and Cayman Island loopholes, we would raise another, $300-400 million a year in taxes, in revenues, and we can use the money badly right now. So I think that's a very good point to make. The other thing, I mean, you also pointed out something about bailing out hospitals. I just want to mention one thing about it. I follow some of the right wingers who are talking about, you know, this is a hoax, and you know, one of their talking points is, well, hospitals are making a killing treating COVID-19. I mean, that's one of the craziest things I've ever heard. Hospitals make their money on surgery and procedures. They're not doing surgery and procedures because of COVID-19. They're just starting to, that's why there's such a great push among hospitals to be allowed to do it, because they're getting killed economically because they can't do the things that make money. So I just want to mention, it's just one more of those crazy right-wing theories that we should, there's not enough time in the day to beat them all back all the time, but if you hear it, just tell people they're full of it.
Okay, thanks for your question, Dwayne. We have one more question in the queue now. It's from Will Stennett. Will, I'm going to unmute your line. You can ask your question now.
Yes, I was wondering if PA has made any decision yet on temporarily waiving requirements for self-insured nonprofits to repay the state trust for funds claimed during the coronavirus. Typically, you know, the nonprofits pay 100% because they're self-insured, right. And under the CARES Act, the federal government's going to reimburse 50%. And I was just wondering if Pennsylvania is going to waive the other 50%, or if they've made a decision or not.
I do not know. I'll see what I can find out, but I actually don't know. Good. It's a very good question, though. And I'm sure it's very important to many of our nonprofit partners. So I'll try to find out.
Jeff, I think you're on mute.
Jeff, can't hear you, Jeff.
This is the problem. I'm always switching back and forth here. Sorry about that. Thanks for letting me know. You're probably going like, hey, his mouth's moving, but we're not hearing anything, which around my house would probably be considered a great day for some of my family members. So we don't have any more questions in the queue. I do want to thank Mark and all of the folks who had questions today for this lively conversation. You can always feel free to email us at Pennsylvania Budget and Policy Center if you have additional follow-up questions or just requests for information. And thanks to Katie for providing access to some of those reports and things that Mark was referencing during his presentation. Those are available in the chat box. We'll do, I think, what we did 2 weeks ago, which is we had a lot of requests. Folks wanted access to the chat transcript afterwards because we had so many questions there and so many reports and links that were shared there. So we'll be doing that again today, or I'll probably get this email out tomorrow. I'll also send folks access to the recording. Again, thanks for that, Mark. Going to move on here to the last part of our agenda today. Just a few updates. In fact, some of these relate to some of the items that people had questions about and some others that were sent in the chat box. I'm going to talk just a little bit about the unemployment numbers in Pennsylvania and the unemployment compensation. There was an online press conference yesterday that the Secretary of Labor and Industry, Jerry Oleksiak, held and provided some updates on this. Obviously the state unemployment system was really hit with a huge number of applications as a result of COVID-19. In the 3 weeks prior to the pandemic outbreak in Pennsylvania, there were 40,000 unemployment applications in those 3 weeks. In the 6 weeks now, since then, we're getting close to 1.7 million applications for unemployment. Folks have been having a lot of difficulty getting through on the system, but the folks at Labor and Industry and Unemployment are doing their best. They have brought many staff on. They've moved staff from other agencies, brought folks out of retirement. The good news is they seem to now be caught up on the PIN numbers that folks need in order to submit their applications. Another development, which we mentioned 2 weeks ago, is the fact that because of action at the federal level, folks who would not normally qualify for unemployment compensation, individuals who are self-employed, gig workers, people who are independent contractors, will be able to get unemployment compensation. Because it's a different category and was not one that previously existed, the state had to get a platform up and online. That actually took place just 12 days ago. On Saturday, it was actually 2 days after our previous call. That went online. They reported yesterday that as of now, I believe it is over 100,000. It's about 107,000 of those claims from independent contractors, gig workers, and self-employed folks have been processed. Unfortunately, those checks have not gone out yet, but the folks are getting their PIN numbers, and they hope to begin distributing payments to gig workers, independent contractors, and self-employed folks by early May, which by my calculation starts tomorrow. I don't know that it will be tomorrow, but hopefully in the next week or so, payments will start going out to those folks because they have been waiting for that opportunity. So the one piece of advice, and if you hear folks who have been trying to access unemployment benefits, one piece of information they had yesterday was now that they are caught up on the PINs so that folks can submit their claims weekly, that if you applied more than 3 weeks ago and have not received a PIN, that would be an indication that there is an error in your application. Could be that the ID was not verified, possibly there may be a wrong address. So if you know of folks who have applied for unemployment and it's been more than 3 weeks and they've not received the PIN, they should get directly in contact with unemployment office to resolve that, because that is an indication that there's an error. I'm going to move on from unemployment, talking a little bit about some other items that we talked about 2 weeks ago. When we had our previous call, our senior policy analyst, Diana Paulson, did a presentation, shared some information about the recommendations that we at the Pennsylvania Budget and Policy have put together about how the state should respond to the coronavirus pandemic. There is a blog post that's up on our website. I think Katie will put that in the box here shortly, and you'll see that. In addition to that, Diana talked about how we were going to be tracking that with a spreadsheet, following up on that previous Zoom meeting, and then again with the invitation for this one. I included in the email the link to that spreadsheet that Diana had created that is now online. Diana has indicated that a number of updates have been made already within the last 2 weeks, and she's in the process of putting additional ones into the spreadsheet. Hopefully those will be available tomorrow. Folks can go back and double check that spreadsheet of the status of policy recommendations. Just a couple quick highlights that she gave me. One is one that I mentioned already, which is that the pandemic unemployment assistance is now up and running for gig workers and self-employed folks. Also wanted to let folks know that since our previous call, Department of Human Services has announced a plan to join the USDA pilot program that would allow individuals to use SNAP online to purchase groceries, and they're preparing plans to submit that to the USDA Food and Nutrition Service. So that is in the works. That's a recommendation we made. We're pretty excited about that because obviously folks who are using SNAP should be able to order groceries online. Also related, Department of Human Services submitted a pandemic EBT plan to the Food and Nutrition Service of the USDA. The plan, if approved, would provide SNAP to students who are eligible for free and reduced priced meals with SNAP. That would provide an additional benefit of $365 per child for close to 1 million Pennsylvania school-age children. I think the number is 958,000 school-age children. DHS would provide the PEBT to qualifying families. So some progress there on that as well. One other item that Diana noted, and this is also in the spreadsheet, you can go and check that, is related to student loans. The American Education Services and Commercial Loan Portfolio managed by the Pennsylvania Higher Education Assistance Agency, FIA. FIA is notifying borrowers that forbearance through September 30th, 2020 is offered upon borrower request. So a number of steps forward on some of the policy recommendations. Again, we're keeping track of all of these and the status of legislation that's been introduced or is in the process of being introduced in the state legislature. That is all on that spreadsheet. Big kudos to Diana for putting together that and keeping that up to date. Again, there are more updates going in today, and hopefully sometime tomorrow we'll have that pretty close to up to date. I do want to note, Diana requested that if you are working on a particular issue area and you notice on the spreadsheet that something has not been updated, if you've had access to information that something is either in the works or has recently been enacted and that's not reflected on our spreadsheet, please email us, email Diana. You can find our email addresses on our website. And Diana would really appreciate any help that those of you who have particular expertise in some of the very specific areas of the policy recommendations to let us know if you see anything that needs to be updated there. Again, thanks to Diana for that. I'm going to just wrap up now talking a little bit about something that has been mentioned already in one of the comments related to FMAP and federal aid. Mark's talked about it a bit. One of the biggest issues that's going to impact our state budget this year, normally, our advocacy efforts are focused pretty much on the state government and the state legislature, but this is one where we will need to be putting some attention and some communication at the federal level. It is how the federal government responds to the tremendous needs at the state government level. Pennsylvania is limited in the way that many other state governments are in the need to have a balanced budget, that expenditures and revenue are lined up and generally matching. The federal government has the ability to provide additional funding, and that may make a huge difference in this. I want to talk quickly about what happened last week. Some of you may have heard this about another package of bills that's been passed in Congress to provide some relief from the pandemic. A lot of our national partners, particularly the Center on Budget and Policy Priorities, which is our national ally, is actually referring to what passed last week as a not a fourth COVID package, but actually a COVID 3.5. Just the way you have software updates like, you know, Windows 9 and then Windows 10, and they come out with Windows 10.1 or Windows 10.2. The package that passed last week is really a patch to fix some of the problems in the administration and implementation of what was passed previously. Particularly this focus on aid to small businesses. That fund had been quickly depleted. This was about a half $500 billion package. Sorry, it was a $500 billion package that was passed. But that really is limited specifically to aid to small business. It also provided some additional funding for hospitals in their costs that they're experiencing as a result of that. But this really doesn't meet the need for significant assistance to state governments coming at the federal level. We and many other advocates and allies, and you'll recall last week you heard a bit about this from our friends at the Pennsylvania Health Access Network, is in particular a need to adjust the federal medical assistance percentage program. This is how funding for Medicaid programs at the state level is calculated, how much the federal government's going to contribute, how much has to come from the state government level. This is a really serious issue because Medicaid programs at the state level and here in Pennsylvania are extremely costly. Medicaid is also a counter-cyclical program in that when the economy is doing very well, we have more people working, more people paying in, and fewer people in need of Medicaid. But when we have a significant economic downturn like we've had right now, it's counter-cyclical. We actually have a smaller amount of revenue coming in, yet there's an increased need, more people in need of medical assistance. This is something that has been estimated could continue to grow over the next year. We're looking at the possibility in Pennsylvania of a revenue shortfall between $5 and potentially up to $10 billion over the next 15 months. It could grow even larger. Part of this, again, is going to be related to Medicaid costs. Some of this also is just need to backfill some of the lost revenue that we're seeing at the state level. So just to wrap up and sort of finalize that, we and many other organizations will be increasing the call on our members of Congress from Pennsylvania and on our senators, Senator Toomey and Senator Casey, to work diligently for a significant major fourth COVID relief package, one that specifically increases the amount of funding going to states in the form of FMAP, but also additional funding for states for lost revenue. Without this money, when our state legislature and the governor try to put together a budget for this next year, if we don't have that kind of additional significant funding coming from the federal level, they're simply going to end up having to make cuts that will prolong this economic downturn. It will put more people out of work. Jobs will have to be cut. Organizations that have contracts with the state government to provide services are likely to see funding cut. So while normally our state budget advocacy is focused almost exclusively on our state government, this time around we really need to focus also at the federal level. We're doing some of this with a new campaign at the Pennsylvania Budget and Policy Center. It's called the 99% Pennsylvania. We're focused on the fact that there's been a lot of assistance and a lot of benefits given out to the top 1% for many decades now. Now it's time for the federal government to do more for the rest of us, the 99% of wage earners in Pennsylvania and across the country. So the campaign, again, is the 99% Pennsylvania. We have a Facebook page up right now. I think Katie's going to put the link there for that. I would encourage you to like and follow the 99% Pennsylvania on Facebook. The 99% Pennsylvania is also on Twitter now. Katie will put the Twitter handle there so you can find that as well. I would encourage you to follow that because, as I noted, there's a lot at stake for our state government, for people across Pennsylvania, and for our state budget. It's going to be dependent on additional action at the federal level. And that's where we'll be continuing to share information about that. We are in the process of finishing a website for the 99% Pennsylvania campaign. We hope to have that up in the next week or two as well. You can look for that. But that's where we're going to start to really give folks the tools to send messages to our senators and to our members of Congress, letting them know that Pennsylvania is counting on them to have the federal government step up and provide the support that only the federal government can provide for the assistance we need here in Pennsylvania. On that note, I'm going to wrap it up there and see if folks have any additional questions, either for me or for Mark or for any of the other folks here at PBPC. Don't think I'm seeing any. I'm going to scroll back here. Okay, don't see that we have any questions. Again, thank you to Mark. Thank you to Katie. Thank you to everybody on the PBPC team. Be sure to check out the spreadsheet that's keeping track of these efforts at the state level and the progress we're making on those. And definitely check out the 99% Pennsylvania on social media. Follow us there, and we'll be providing you with more information about calling on our members of Congress and the Senate to take action for federal relief for Pennsylvania and the rest of the country. As I noted, unfortunately, we did not have Representative Bradford here today. We are tentatively planning to do an abbreviated Zoom meeting next Thursday at 1 p.m. We do need to finalize that with his office, but I will send out a link for folks to register. We are really looking forward to hearing from him because of his role on the House Appropriations Committee as a Democratic chair. We'll provide that, and we're looking forward to doing that. We will be back again for a Zoom meeting 2 weeks from today to provide you with additional updates on state budget and COVID-19 related issues in Pennsylvania. Again, thanks to everybody, and appreciate you taking the time to be here with us today. Again, reach out to us anytime, email us. We'll be happy to provide you with any information we can. Have a great day, everyone.